My name is Dr. Mahmood Nadim. In this video, I will talk about ankle sprain or lateral ankle sprain. So firstly, we will discuss about what's the lateral ankle sprain means. Lateral ankle sprain means when there is an inversion and plantar flexion of the ankle joint. As there are a lot of ligaments in the ankle joint, but today we are specifically talking about the anterior talofibular ligament. When there is a ligament injury, there are three types of ligament injury. Either there will be a lighter sprain or stretching of the ligament that may cause some type of micro level injuries in the ligament, that is called grade 1 tear or grade 1 sprain. And second one, if there is more stretch or more trauma to the ligament, then there is another grade of the injury that is called grade 2. In grade 2 there is a chances of partial tear or partial rupture of the ligament. And of course, in third grade or third type of injury to the ligament, that is a complete rupture or complete separation of the ligament. So that is called grade 3 injury. When there is such type of injury to these ligaments, there is a collection of fluid and there is a edema and swelling of the of that area. And in case of ankle joint, when there is a such type of trauma to the ankle, like trauma to anterior talofibular ligament, of course there is a swelling, edema, and non-functioning of the joint. So let's see the diagnosis of anterior talofibular ligament. There are two types of diagnosis. One is ultrasonography and second is MRI. So MRI is more expensive and not everywhere available, or the dates are so long. So ultrasonography is more commonly and easily available everywhere. Let's see in this image, this is ultrasonographic image of the anterior talofibular ligament in case of an ankle sprain. So in this image, on the top there are three arrows, white arrows, that shows this is a normal ligament. So this normal ligament, it look like this in the picture. So this ligament is in between fibula and talus bone. So when there is a sprain or trauma to see that there will be a change in the consistency or in the image of the this ligament. So in this image, you can see there is a distortion of the image, means the tissue changed totally, and in the image, because this is a sonographic image, so technically speaking, there is some fluid inside, edema, swelling over there, and there is a strain or stretch to the. Then we go to the other image, we can see there is no ligament in this image, and there is a lot of fluid inside and tissue swells up, and this is the image of the complete rupture of the ligament. So this is the third grade type of injury. So this is the almost concept of sonography. Now we will go to the directly to the management. In case of such circumstances, when there is such type of ankle sprain or trauma, first thing should be done just to immobilize the joint immediately, no walking, no working, and put some type of icing time to time, 10 to 30 minutes, 3 to 4 times a day, and put some elastic bandage just to stabilize and reduce swelling. So this is most important, and you can also elevate your limb as in the picture, or elevate your ankle joint as shows in the picture, and can also stabilize the joint just to make it stable, not to swells up or more injury to the joint area.